How to fix my under eye area. The skin under my eyes is wrinkled and loose. What is the best way to fix this, with or without surgery?
Thank you for your question. You submitted a photo and it's a very simple question, how to deal with the under eye area, and you state that you're concerned about wrinkles and loose skin under the eye. Now, although the photo is a single photo and it doesn't show the different positions of your eye, and of course we're limited by the inability to do a physical exam, I'll give you a sense of how we approach this concern in our practice every day. I'm a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island in practice for over 20 years. So dealing with under eye wrinkles is a daily task for a lot of our patients who come to us with these concerns. Typical story is that a patient will first try topical creams because a lot of creams make claims about improving the appearance of under eye wrinkles. Of course, they imply that they have a long-term benefit, and the reality is at least most of the over-the-counter creams don't have enough active ingredients to actually make real changes, but will kind of improve through moisturization, essentially, the appearance of under eye wrinkles. So we have to think a little bit systematically about what we need to understand before we initiate a treatment. First is the presence or absence of excess skin. You see, the under eye area can be very deceptive. The eyelid skin can appear to be loose, which would imply that there is excess skin. But in reality, it could be just an issue of skin quality. In other words, it's thin and therefore a little weaker than it used to be, as opposed to the skin quantity. And so, based on that differentiation, you can avoid a lot of the issues that we see as a specialist. As a specialist, I deal with a lot of people who come to us from all over the world who have complications of lower eyelid surgery. And very often it is from the aggressive removal of under eye skin with the intention of making the skin tighter. You see, I also do facelifts, and I can give you a real distinction in the difference between excess skin when doing a facelift and excess skin when we're doing eyelid surgery. When we're doing a facelifting procedure, the skin is overlapped over the incision site, but the part that we're working on is very stable, and therefore it won't shift or move the same way. Of course, if there is excess tension, the scar can widen, but it's very different with lower eyelid surgery. If more skin than can be taken is removed, the eyelid will actually literally pull down, and it'll become retracted, or it will evert, turn away, and the term is ectropion. So to ascertain that, when I do an examination, I do basically an evaluation to look at the tension, the laxity, and sometimes pinch a little bit to see if there is extra skin. Now, most people who present with these issues tend not to have extra skin. And so, or if they do have wrinkles under their eyes, the other aspect of this I didn't mention is the support of the lower eyelid. You see, if you think of the lower eyelid like a hammock or a clothesline, when it has a decent amount of tension, the lower eyelid is in a higher position. If it gets laxed, then the lower eyelid can sag, or the tone can cause the skin to sag. And therefore, instead of dealing with taking away skin, we actually need to reinforce the support of the lower eyelid. And typically this is done from the outer corner of the eye and doing procedures such as lateral canthopexy or lateral tarsal strip. But the point is that the clothesline has to be given more tension rather than take away skin, otherwise it just pulls down further. I will say that lower eyelid surgery is deceptively oversimplified, and it's part of the reason why a lot of people have these challenges with lower eyelid surgery. So putting that now aside, let's define skin quality and the wrinkles and what our strategy typically is. Well, when you think of wrinkles, you think of it in the terms of the skin getting thinner and the support underneath the skin becoming diminished. And the key element of that are proteins such as collagen that are responsible for this. So what we do is we approach this in a couple of ways. One is to help to build up the collagen and skin quality from underneath the skin. And to do that, we use something called platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it is a concentration of the growth factors responsible for wound healing when you get a cut. We've been able to see that with injection of platelet-rich plasma, we're able to improve skin quality, soften fine lines and wrinkles, and get the skin to be healthier. As we age, we lose collagen, we lose blood supply, and so platelet-rich plasma is manipulating the wound healing concept to generate new collagen and generate new blood supply. We also use thermal energy. We use a fractional CO2 laser. Fractional CO2 laser can be very effective, especially on people with lighter skin, where we can actually take down several of the top layers of skin and generate thermal energy to the deeper layers, and that results in smoothing and softening of the fine lines and wrinkles. We always want to be careful. We never want to go too far. If you want to look like porcelain, it is, in my opinion, too aggressive. You can improve the appearance of the lines. You don't want to try to make it look unnatural. So thermal energy from the outside, platelet-rich plasma from the inside. The last but also important factor is the activity of the muscles around the eye. Now, everyone's heard of Botox and Dysport and basically neurotoxins that relax the muscles responsible for creasing the skin. What happens is when you activate these muscles, the skin wrinkles over and over and eventually the creases stay. So strategic placement of Botox or Dysport can also be beneficial. So as you can see, there are many options, and the art is in organizing them and prioritizing them and implementing them in the right way. So my recommendation is actually meet with a cosmetic surgeon and learn what your options are and get a sense of what the results are like, and understand that lower eyelid position and support is critically important if you choose a surgical option or if you need a surgical option, to make sure to avoid some of these misadventures that do happen when the lower eyelid gets pulled down. And as far as those other options, certainly explore all of those. It's always about customization, and one size doesn't fit all, and one approach is not right for everybody. Again, there's art and finesse to this, and it's very important that you feel comfortable with the doctor who will take care of your concerns. So I hope that was helpful. I wish you the best of luck, and thank you for your question.